Another Plapto station with Dr. Al. So I got a really interesting case here. A case that could either come as a dermatology station or as a medicine station. To be fair, I got the inspiration for this station from myself. I recently was diagnosed with this. I had chest pain. All right? It was here on the right side of my chest. It wasn't spreading anywhere. It was localized. It started suddenly. It got worse slowly over 2 days. It reached a point where even putting on a shirt makes me an ache. What is this? So basically, by now you either have something in mind or you don't. But then the GP asked me, "Is there any other complaints, any other symptoms?" I said, "I noticed that the area is a bit red and it's itchy, and there are some vesicles. You know it by now. Of course, it is shingles. Has it ever popped in PLAB? No one knows. Could it pop in PLAB? Of course it could. Everything could pop in PLAB." My GP was actually very nice. All I had to do is send the pictures of the rash to the GP. They took a look at it and they prescribed the medication. In case of PLAB, what you need to ask about are basically the same thing that my GP asked about. Am I immunocompromised? Am I on any medication that lowers my immunity? Have I got in contact with any person with shingle? Possibly. I've already given all of those to my GP before the moment that I said I'm gonna send the picture. I said, "Listen, I'm querying shingles," and I straight away answered all of those questions. You want to start the patient on acyclovir for management. Of course, you can prescribe some painkiller. You can prescribe paracetamol. You can prescribe ibuprofen. You can also prescribe prednisolone with shingle because it helps with the swelling as well and the inflammation. Usually, investigations are not required for shingle. This is something nice you need to know. Unless if you want to refer, in which cases you refer, in the cases that you possibly might admit, like serious case with complication, like ophthalmic distribution, visual symptoms. These are the ones you're going to admit. The one you're going to refer are anyone with new vesicles forming after 7 days of treatment, meaning the treatment has failed, if the patient is severely immunocompromised, or if the pain is not controlled, the patient is in agony. This can either come as patient with rash showing you a picture of shingle, or the same way I came to the GP, which is chest pain, help me with it. Does that